My name is Jeneen Iwugo. I am Deputy Director for the Quality Improvement and Innovation Group here at CMS. I also am leader of the Person and Family Engagement efforts here at CMS. We've begun to bring patients into the room throughout all of the tasks that we have here in the QIO program and making sure that their voice is continually heard as we implement the healthcare quality improvement task that we've committed to achieving. You know, the conversation really does change when you have a patient in the room and they're empowered to engage in conversation and to speak freely about how they feel CMS is doing when they're implementing these policies and programs. So I would say that over the last 2 years, we've done a really good job of that, and it's growing and growing every day. A great example of how CMS quality networks are engaging in person and family engagement is the hospital engagement networks. They were integral to implementing key metrics in hospitals that were used to strengthen person and family engagement by requiring or tracking the number of huddles and shift changes that were done at the bedside. In addition, they helped hospitals understand the importance of having a patient advocate available for consultation with patients who are making tough decisions with their providers or who just need help engaging in their healthcare and giving feedback to their providers. The QIOs also have done a great job of creating and establishing patient advisory councils, which help not only inform the QIOs about their policies and programs, but also make sure that we have a continuous feedback loop between patients and QIOs and CMS about how we're doing with patient and family engagement and how that's impacting beneficiaries in their communities. Another great example of a network contributing to person and family engagement is the Everyone with Diabetes Counts program. I actually had the opportunity to attend one of their sessions and learn about pre-diabetes. As well, I learned about the impact that this has on the community, things to look out for, and the best part was that it was taught by patients. They implement a train-the-trainer program, which allows that work to spread throughout the community and for it to be something that's sustainable.
Patient and family engagement is an agency-wide initiative across CMS. Specifically with BFCC, what we're focusing on is immediate advocacy. It doesn't address quality of care complaints, but immediate advocacy is more addressed toward complaints that can be resolved relatively easy and quickly, such as a beneficiary who needs assistance with a resource or service that Medicare provides that they weren't able to obtain, for instance, having a wheelchair delivered to their house. It also addresses things like quality of communication between providers and beneficiaries, issues or concerns related to room cleanliness, quality of food being delivered or served. So these are the issues that immediate advocacy can address. Another way that the BFCC-QIOS will be engaging patients and families in their work is through working with the BFCC-NCC, which is the National Coordinating Center. They have constructed or formalized a Beneficiary and Family Advisory Council, and this council comprises of 17 Medicare beneficiaries from across all 5 QIO areas or all 50 states. And basically this group of families, patients and their representatives gather together to provide perspective and beneficiary experience that relates to the QIO work. So once again, this is an opportunity for beneficiaries, families, and their representatives to have a voice in the work that is conducted by the BFCC-QIOS and to ensure that their voice is heard.
Medicare beneficiaries are at the heart of implementing person and family engagement. We need feedback from people who are being treated, who are receiving services, and who have opinions about how that service was provided and who can assess the quality of care that was provided in order for us to be successful. We have constantly engaged and encouraged beneficiaries to team with us, to talk to us, and to do so continually through multiple feedback loops. CMS and the QIOs are extremely committed to person and family engagement. And that commitment doesn't just mean implementing it or starting it. It means evolving, adjusting, and maybe tweaking if we need to as we go forward. We really encourage you to reach out, take a look at the newly released person and family engagement strategy that CMS has rolled out. That's a great picture of our plans going forward and what we think is most important. We want to make sure that beneficiaries know that we support them in being active contributors to the healthcare environment, that we want them to be co-partners in designing their care, and we want to make sure that everyone understands the questions and the answers that they need to make difficult decisions when they're in a healthcare setting. If there's ever anything that we can do differently, better, or more of to make your healthcare quality care, please reach out to any of us or to the QIOs to make sure that we get that feedback and we incorporate it as we're going forward developing our programs. Thank you.